So for today's video, I'm gonna performing the segment 4, which are the abdomen, lower extremities, and the neurological. So here are the tools and equipments needed in the assessment. So pair of gloves, alcohol, and the stethoscope. So next, provide privacy for the client or the patient.
Go.
Then next, we're going to perform the hand hygiene, and after that, wearing of gloves. So now I'm gonna wear the gloves. So, good day ma'am. So, let's proceed to the abdomen. So, I will inspect your abdomen first. So, as I see your abdomen, so it's flat and it's not formed like there was a small mountain, and it's not rounded rather. So, everything is good and just normal. So now let's listen to the diaphragm of our stethoscope, and we're going to start in the right lower quadrant. So is it okay with you, ma'am? So first we're going to listen using the diaphragm stethoscope. Start to the right lower quadrant, then after right upper quadrant, then next left upper quadrant, then left lower quadrant. So next, we're gonna use the bell, the back version of the stethoscope. So the same, so start from the right lower quadrant, then right upper quadrant, to the left lower quadrant, left upper quadrant rather, and then to the left lower. As I check the patient abdomen, so using the stethoscope, the diaphragm and the bell, so I hear 15 sounds. So the normal sound is 5 to 30 sounds, and it should be done in a minute. So I should hear to 5 to 30 sounds per minute. Okay, so if I don't hear any vowel sounds, so I need to listen for full 5 minutes, and I need to note, are those normal or are they hyperactive or hypoactive? So as I check the patient abdomen, so it's hypoactive because the sound is more than 10, so it's normal to the patient abdomen. So now let's listen for the vascular sound. So we're gonna do it with the bell of our stethoscope, and we're gonna listen at the aortic, and we're gonna listen at the radial arteries, iliac arteries, and we could listen at the femoral or arteries if you need. So you're gonna listen at the arteries. So is it okay with you, ma'am? Okay. Using the stethoscope, we're gonna listen using the bell. First, is at the carotid arteries, which found at here. And the next, to the right, down to the left. So next, we're gonna listen at the iliac, and it's a little bit below, at the very bottom of the right. So, or in the middle, and this is the iliac carter 2. And then we're gonna listen on the other side again. I like to point it out and start this. So we're gonna listen at the iliac artery. I could listen at the femoral artery. So it's normal to the patient. And I feel a little sound. So ma'am, next is the palpation of your abdomen. So first palpation, we're gonna palpate your abdomen into two ways, the light and the deep palpation. So first the light palpation. So is it okay with you, ma'am, to palpate your abdomen? Do you feel any pain, ma'am? How about this side? Okay, so the patient didn't feel any pain in the light palpation of her abdomen. So let's go to the deep palpation of her abdomen. Is it okay with you, ma'am? Do you feel any pain, ma'am? How about this side? Okay, so the patient didn't feel any pain while doing the deep palpation on her abdomen. So her abdomen is normal. So, ma'am, do you feel any pain in doing the assessment today?
No.
Or any tenderness?
No.
Okay, that's good to hear, ma'am. So, once again, I'm Nurse Eldred Pondias. So, we're done with your assessment. The chest, the chest, upper extremities, and your abdomen. So, I don't see any problem, ma'am, with the weight. So, everything is normal. I don't see any abnormalities, lesion, and swelling also. So that's all for the assessment, ma'am. So thank you for your cooperation for today. So we're done with the assessment. So I'm gonna remove my gloves. And throw to the garbage if necessary. And after that, apply the alcohol. So once again, I'm Nurse Eldred Pondias, your nurse, and thank you for watching. So this time I'm gonna proceed to the lower extremities. So first inspect the lower extremities of the patient. So I'm gonna observe her the skin, such as it is symmetrical, the condition, hair growing. Okay, so next, observe if there is abnormalities, so such as symmetry, venous patterns, and lesion and edema. So I didn't see any abnormalities of the lower extremities of the patient. So now I'm gonna check the leg temperature of the patient using the back of my hand. Is it okay with you, ma'am? Okay, so let's do it. So as you get temperature from this area to the top. Okay, so the leg temperature of the patient is not cold. It's not. She don't feel any cold, so it's normal and it's very warm. Normal warm rather. So now I'm gonna command my patient. So is it okay with you, ma'am, to flex your knee? Okay. So I'm gonna feel the pulse under her knees. So the pulse are both equal, and again it's not be too fast and it's perfectly normal. Then next I'm gonna palpate the posterior tabialis pulse of the patient. So is it okay with you, ma'am? Okay. So in this way I'm gonna palpate. The other side. So do you feel any pain?
No.
Okay, so while palpating the area of the posterior tabialis pulse, the patient didn't feel any pain. So next I'm gonna check the edema of the patient by pressing the medium ileosis of the patient. So is it okay with you, ma'am? So now I'm gonna press the medium ileosis every 5 seconds. Do you feel any pain, ma'am?
No.
To the other side. So do you feel any pain, ma'am? Okay, so both sides while palpating or check, the patient didn't feel any pain. Okay, so I'm gonna continue to assess the leg of the patient by evaluating the sensory functions. The next, I'm gonna lightly support the leg in one hand and endorse the foot on the other hand. So is it okay with you, ma'am? So do you feel any pain? Okay, to the other side. Okay, so after that, so I'm going to test the patient of the heel to chin test. So can you put your heel to your knee, ma'am, and slide? Okay, to the other side. Okay, so the patient can do it very well, and she can slide her heel to her cheek rather. So next, I'm gonna assess the patient to stand up. Okay, ma'am, can you stand up? Okay, so in this segment, so I'm gonna let my patient walk to 10 to 15 feet. So let the patient walk at 10 to 15 feet and turn, then walk back towards. Okay, so the arms should be swing free, and okay, so and she should turn without losing her balance. So next I'm gonna test my patient, which is the Rubric Test. So in this test, the patient should stand her feet together and with her hands also, and close your eyes, mom, and I'm gonna observe you in 20 seconds. So in this kind of test, which is the Rubric test, the patient should not lose also her balance while she's standing in 20 seconds while the nurse is observing. Okay, mom, time's up. So in this time, mom, I'm gonna assess your walking. So in this time, you're gonna walk to heel toe in a straight line. So can you do it for me, mom? Okay, so walk heel to toe in a straight line and without losing your balance, and turn. Okay, walk again, heel to toe in a straight line. Okay, again, turn. Okay, so walk again, heel to toe, turn. Then, okay, heel to toe in a straight line. Again, turn. So my patient do it very well, and she walked in a straight line with the heel toe. So she do very well. So so we're done with the assessment. So overall, my summary of findings for you is I don't see any abnormalities. You perform well. I don't see any problem with your lower extremities, and thank you for your cooperation. So God bless.